So in Buddhism, we talk about how the mind is the creator of our experience. And as Venerable Children explains in Taming the Mind, her book, Taming the Mind, we can think about this in two ways. First, how the mind motivates our actions, or karma. That refers to how the imprints of our actions are stored on our mind streams. And when these karmic imprints mature, they influence the situations we encounter. And another way the mind is the creator of our experience, that's also related to the first, is also how our minds interpret and discriminate whatever we contact, and how that filters our perceptions. And by doing this, our minds determine how we experience the events in our lives. So in this time of COVID-19, I've been thinking a lot about the role of the mind, society, and culture in shaping our responses to illness and disease. So it's not something I've fully worked out in myself. It's kind of an ongoing rumination. And I'd just like to share with you some stories that have been coming to mind again and again in relation to this. So the first is a book that I read more than 10 years ago, and it's entitled The Spirit Catches You and You Fall Down, a Hmong child, her American doctors, and the collision of two cultures. And it's by a journalist named Anne Fadiman. And the book is about a refugee family from the Hmong ethnic group that migrated from Laos to Merced, California. And one of their daughters starts to have seizures when she's 3 months old. And at first she's misdiagnosed at the hospital. They don't have anyone who's a Hmong interpreter, so the parents don't understand what's going on. So already there's a lot of misunderstanding and mistrust from the get-go. But eventually the daughter is diagnosed with having a very severe form of epilepsy. And the doctors give her a course of oral medication, I believe, to treat the condition. By this time, the parents don't trust Western medicine, and they actually decide not to give their child the medication because they believe instead that her state shows that she's spiritually gifted. And then they start to use traditional remedies to treat the child. But so as a result, too, the child goes in and out of the hospital repeatedly. And by the time she's 3 years old, the American doctors who have been treating her actually remove her from her parents and put her into foster care for a year because they consider the parents, not complying with the medical requirements and instructions they're giving. So again, big cultural misunderstanding, miscommunication, very traumatic for the parents who love their child dearly. Right? And then a social worker gets involved and helps to advocate for the parents and so on. Eventually, the child is returned to the family. But after her worst seizure, the doctors suggest transferring the child to another hospital that can provide more advanced treatment. Yeah, they've already done everything they could. But for some reason, the parents misunderstand that the doctors are doing this because they have vacation plans. So really, it's a terrible misunderstanding throughout the whole process. And eventually, the child goes into a coma after a seizure at age 4, and she lives in a vegetative state for 26 years. And the family cares for her the whole time. So in between this incredible story, the writer also talks about Hmong culture, the history of Hmong immigration to America, and the American involvement in the war in Laos, which I didn't know about before I read this book. So it's very rich, and it's an excellent book, but I don't have time to get into that here. But what I found most compelling about the book, and why I still think about it today, is how it didn't pass judgment about either Western medical science or Hmong culture. It really tried to strike a very balanced view. You really empathize with both the American doctors who were doing everything they could to save the child and the Hmong parents who were just kind of confused, horrified, traumatized by the whole experience of entering into a Western medical system. And she kind of leaves you with the question, of which system of beliefs would bring about a more beneficial outcome. She doesn't answer that. She just puts it forward and leaves that with you at the end of the book. So in the Western culture, where what's happening with this child's body is seen as a disorder, right? There's a diagnosis, it's called seizures, epilepsy, and then there's a course of medical treatment. Right? So as a result, the child's life was saved, but she also wound up living in a vegetative state. So this writer puts forward another possibility that perhaps in the Hmong culture, she would be regarded as someone who's gifted. It's not a disease, it's not a disorder. This is the spirit catching you. You have a gift, you can communicate with the spirit world. This child might have become a shaman. She might have been revered, maybe played a very special role in her community. Yes, she would have had repeated seizures, incredible physical suffering, and most likely she would have died a natural death at a young age. So that's what the writer leaves us with, like what is the outcome of different systems of belief that we hold? At least that's what I was taking out of it. And of course, the book is pointing to the importance of taking culture and communication into account when it comes to healthcare. And thankfully, the hospital that was involved has developed a lot of intercultural training programs, and because it takes care of a big immigrant community. But when I reflect, I always reflect on this story when we get teachings on dependent designation, because we talk about how things that exist in dependence upon the mind that conceives and labels them. And I think I used to think of it as like, okay, here's my mind. Here's this object, right? And I'm just me putting some sticker on it. And to transform my mind, I'm gonna peel off the sticker and put a new one, like that. Yeah, like, oh, you're now not my enemy, you are my friend. Okay, right. But I think we see that just the process of even using a word, it's like embedded in this whole system of cultural beliefs, right? Like how we describe something that we see and what's happening, what we believe about ourselves, all that is coming into play. Just saying, oh, this person's shaking on the ground, oh, having a seizure, this is what we must do. That label carries this whole worldview with it, right? Versus, oh, spirit possession, okay, this is a good sign, Yeah, all that's happening as we conceive of what's going on. And how we respond to it is conditioned by that, and all the results function accordingly. Yeah. So that's the part that amazes me, I think, and that reminds me that, wow, how I think about things, the mind really plays a very profound role in shaping how I see the world, myself, and my experience. So it's of paramount importance to work with it. So I've also been thinking about this then in relation to what we're now calling a COVID-19 pandemic. Yeah, and there's a worldwide debate, it seems, about is this a hoax or is it an infectious disease? Yeah, and that's shaping how people are responding to it. And I think I'm still even just trying to make sense of like, why is there a debate? Because to me, it's very obvious, right? This is an infectious disease, period. But reading this book made me, just thinking back about the book, made me think, what are some of the cultural conditions, assumptions, and so on that are making people think this is a hoax? Yeah, it's coming from an entire worldview that I don't understand, maybe some cultural beliefs. Like, what if I see it and try and respect it as a different alien culture, right? And try and understand what are the outcomes of believing it's a hoax. So anyway, in thinking about this, I was just thinking about what appears to me to be different communities and how they perceive COVID-19 is shaping what's going on in a very clear way. And I would say political leaders and communities that are calling it a hoax, right, are just basically not believing that it's an infectious disease, right, and are not following the advice of people who are experts in infectious disease. And we see the outcome of that. High infection rates, but you see, these people don't believe in infection rates. High number of deaths as a result, yeah, and a refusal to engage in behaviors that might prevent the spread of disease. So that's one set of outcomes. And I personally believe that it's helpful to label this an infectious disease, because what I see is that communities that are responding to this as an infectious disease are saving lives. And I don't know about you, if that's your fundamental motivation, if you believe in the value of life, this is a good outcome. Yeah. This morning, I just read a piece about the Eastern Band of Cherokee Indians. And I'm just going to read you the opening paragraph because it relates to culture and disease and kind of summarize what she talks about. So this was a piece published in The Atlantic by a writer named Annette Saunuki-Klebsaddle. Sorry for the mispronunciation. So she says, the Eastern Band of Cherokee Indians has for centuries practiced the booger dance to ward off illnesses and other malevolent forces. As night descends, men selected as boogers, or evil entities, appear in tattered clothing and absurd masks made from gourds, wood, or hornets' nests. They mimic outsiders, typically Euro-Americans, and exaggerate lewd behavior as they dance. I was taught growing up that the dance stemmed from the tribe's experiences with devastating sickness such as smallpox, which Europeans brought to American soil. The ceremony is a reminder that we must always work to keep our home and people safe. So she goes on to talk about how the 19,000 of them who are 16,000, members of the tribe, very early on did research on COVID-19 response models across the world, and the tribal health officials felt that the South Korean model would work for them. So they very early on and quickly closed their borders. They implemented mass testing, contact tracing, isolating of cases. So, they put the label, this is an infectious disease on this phenomenon. Let's trust what people are saying about infectious disease worldwide, and let's implement these measures. They did not wait for state and federal guidelines. They paid workers who were laid off. They paid more to essential workers because they had reserves from running the casino. And they've had very good outcomes. It says, as of July 24th, the EBCI, thank you, Eastern Band of Cherokee Indians, has reported 3 deaths and 112 positive results over the course of the entire pandemic. So, applying this label and putting in practice this set of infectious disease protocols is working to save lives. Yeah. And it's very adorable. At the end of the article, there's a giant picture of a very large traditional totem with a big mask, wearing a big mask. So she said what they've done is the local seamstress sewing shops have been sewing giant masks to put over all the traditional statues. Yeah, and they're seeing this as a sign of community solidarity, to really protect life within the borders as far as they can. So I guess I've been thinking about this, just in terms of if we want to save life, how to engage with people who think this is a hoax. Yeah, like judging them, criticizing them is not going to get people to change their beliefs. Yeah, so I think probably there must be, hopefully, medical anthropologists out there thinking up creative ways to engage. The only way to get through this is through communication. It's like, okay, you can believe what you want about it being a hoax, but to save your life, let's find a way to communicate. Yeah, I mean, there's these terrible stories coming out of people who thought it was a hoax and all the way up to telling the nurse, I thought it was a hoax, and they die of the disease. There was a story like that of one man in Texas, I think, who was on his social media page posting, about how he just would never wear a mask because he didn't believe in it. And he has died of the disease. Yeah. So it's very tragic that what we believe is now a matter of life and death for ourselves, for our communities. So it's still something I'm thinking about, but for sure, working with the mind, understanding, just trying to see what the outcomes of our beliefs are. I think that's something we need to think very deeply about now, and to find ways to communicate, to create community, and to save lives. I really think what His Holiness said about how survival of the most cooperative is how we're going to survive, is ringing exceptionally true at this moment. And this is really not about survival of the fittest. We can see that really it's the communities that band together, that find ways to do things that work, that are going to pull through and survive this pandemic.